Hello and welcome to McLaren Port Huron's Today's Health Program. I'm your host, Michelle Baker. Today we'll be talking about advanced care planning and end-of-life decisions. Joining me is Diane Schunk, nurse practitioner from Marwood Nursing and Rehab. Diane, thank you for joining us today.
Thank you for having me, Michelle.
Now, can you describe for us what is advanced care planning?
Advanced care planning is essentially when a patient can indicate what they would like as far as medical treatment towards end-of-life care.
Now, when an individual is diagnosed with a chronic or serious medical condition, I would think it might be helpful to talk to your physician right away about advanced care planning. Are there any helpful tips or questions that you would suggest for that?
Yes. Essentially, when you talk to your physician, you're going to want to know the diagnosis, and your diagnosis drives your treatment plan. So you will want to ask him everything from medications that you may have, any treatments you'll be undergoing, and if the treatment fails, what is the next plan? What is our next goal?
Now, as part of advanced care planning, there is an advance directive. Can you describe what that is for us?
The advance directive is a legal document in the state of Michigan. It's called the Durable Power of Attorney for Healthcare, and it essentially will delineate what a patient wants towards end of life, whether they want to continue treatment, whether they want to withhold treatment, and what those treatments are.
In the advance directive, do they designate somebody to carry out these wishes?
Yes, they do. You would want to choose somebody that you trust, that would carry out your wishes if you could not make those wishes known yourself. A lot of times it could be a spouse that you designate as your power of attorney, but it has to be witnessed by somebody other than your spouse, your children, your physician. So essentially it could be a stranger that is witnessing this, and you should keep a copy, give a copy to your patient advocate on your physician's chart, or even if you're admitted to the hospital, these papers should be presented at the time that you're admitted.
Now, what are some examples of decisions or choices that might have to be made in an advance directive?
In an advance directive, you may want to let your wishes known as far as resuscitative efforts, if you want to be in do not resuscitate, as we call it, or if you do not want to go back to the hospital for any further treatment. And you actually can purchase do not resuscitate bracelets that you can actually wear, or even if you're at home and let's say you're not doing well and you feel very strongly that you do not want to be resuscitated and EMS services arrive, as long as you provide those papers to them, those will uphold.
Are there other parts of the advance directive regarding, like IV fluids?
Yep.
Or?
Yes, nutrition, hydration, if you're in kidney failure, end-stage kidney disease, if you want to proceed with dialysis, and things of that nature, because some people feel very strongly that they do not want any of that type of treatment.
Now, why is it important to have these discussions and to have an advance directive?
It's important first because we want to make sure that the patient's wishes are carried out, and if they are spelled out very clearly in the form, we can ensure hopefully that the person that you choose to be your advocate would carry those out. But it also takes off a lot of stress from your family. It will allow them and give them peace of mind that they are following through with your wishes.
Now, oftentimes we have heard that it's awkward or uncomfortable to discuss end-of-life issues or even an advance directive with a family member.
Yes.
How and when should these conversations take place?
They should take place the earlier the better, because none of us ever know the hand that we're going to be dealt. So if we get, it doesn't matter if you're 18 or you're of advanced age, you should get those in place because it gives everybody peace of mind. And, even discussing it with your physician, because then they will also know what your wishes are as well.
And for those who have that advance directive, their wishes are so clear that I would think that would take a huge burden off of the family
Yes, it
of
does.
having to make those decisions for you in case you're unable to.
Yes, it does. I mean, they may not agree with it, and we have seen it where families do struggle, but for the most part, they are very receptive and will carry out the wishes that are on the advance directive.
Now, what types of medical conditions often require palliative or hospice care?
There's several conditions, you know, a lot of people just think it's, you know, for cancer, but palliative care services, we often do aggressive symptom management for patients with end-stage chronic obstructive pulmonary disease, congestive heart failure, end-stage Parkinson's disease, Alzheimer's disease, and of course, terminal illnesses such as cancer.
How would you know as an individual when it's time to shift from the goal of treatment being to cure the patient to provide comfort for the patient?
Well, we would, of course, if we see a continued decline despite our medical efforts, if they've undergone treatment and they continue to decline, we would consider it possibly medically futile, where we've exhausted our efforts and now it's time to talk to the patient and their family about transitioning from our symptom management to actual end-of-life care.
Diane, for those individuals who are interested in completing an advance directive, how do they get information about that process?
If you're in the hospital, you can inquire about it through social work. They would be able to provide you with the paperwork, but there's also a website that you can go to at www.msms.org/DPA, and you should be able to download the form, but I believe it is a $2 fee. And you do get a set of 2, so then you could give it to your patient advocate and keep a copy for yourself.
Diane, this has been great information today. Do you have any closing comments for our viewers?
I'd just like our community to know that at Marwood Nursing and Rehab, we are available. We have a team of myself as an advanced practice nurse, along with our physicians, our skilled nurses, our social workers, and of course our McLaren hospice team, that we are here and available to help you transition to end-of-life care.
Diane, thank you for joining us today.
Thank you.
Stay with us. We'll be back after this break.